Hey, what's going on? I just now finished up with a patient phone conversation and another patient in the office too that has something similar, and which is neuropathy, specifically diabetic neuropathy, which is quite common nowadays. There are a lot more people with diabetes, and subsequently, there will be a lot more people with diabetic neuropathy due to uncontrolled or unmanaged diabetes. And sometimes the neuropathy can play a minimal role, and other times it can play a very large role in how the patient feels and everything. So, in this particular case, the patient had numbness and tingling on the bottom of the foot, as well as a little bit of pain on the top of the foot that was more attributed to midfoot arthritis and the exostosis, or the bump, the spur that he had right there at the top of his midfoot. So that's what that really came from. But in terms of the tingling on the bottom of his foot, he said it was constant, just all day at a low level for the most part, and every once in a while he gets sharp shooting pains in his feet. So some of the issues that contribute to that sensation are blood sugar levels that can be uncontrolled, which does a number on the nerves. Won't be too technical with this little small talk, but it does a number on your nerves. Outside of that, we also have a decrease or a change, should I say, in the soft tissue structures down there on the bottom of the foot. So it's always important for us to get vascular testing as well as nerve testing on a patient like the one that I just now seen, because of the fact that he can have a decreased blood flow, which means decreased oxygenation to some of those smaller sensory nerves, which can contribute to neuropathy as well. So there's other reasons as well. Those are like the main two, and I'm leaving it at that because that's what was narrowed down in this gentleman's case today. But nonetheless, the point being is that diabetic neuropathy is a major pathology that can be quite debilitating. And it's something for us as podiatrists, but also other specialties as well, especially endocrinology, primary care docs, vascular docs as well, to be cognizant of, which we are. And also, it's something that will become, unfortunately, a little bigger as time goes on in terms of its commonality. So, just wanted to let you know, on this particular patient, we're getting vascular studies done since this is the first time we saw the patient. We're getting some vascular studies done, and we're also getting nerve conduction studies done as well. So in the office, I did my own nerve diabetic foot exam on him, which he did pretty decent on. But of course, we're going to get some more extensive studies on him, and likely he'll be in diabetic inserts, diabetic shoes, as well, in order to cushion and take some of the stress load off the bottom of his feet and disperse the stress load throughout the bottom of his feet. So, diabetes with neuropathy puts him at risk for other things, such as breakdowns of the skin and ulceration, as well as tightening of the joints, and increased pain, metatarsalgia, which is pain in the actual bones themselves. That tightening of the joints is synonymous with like lack of flexibility. So there are other scenarios that could potentially arise from the diabetic neuropathy, and these are things that we try to prevent and even reverse course with the diabetic neuropathy as well. So we're at the early stages for this young gentleman, and we're getting all the testing done first. And after the testing, then we'll dive into a comprehensive treatment plan for him. So I'll talk to you guys later. Thanks.